I see you bright and clear. All right,
Yeah.
good.
Yes,
We're on the
sir.
same wavelength now.
Right on. Nice to meet you. Where are you coming out of?
Right now, I'm in North Scottsdale, Arizona.
Okay. Okay. Is that where you
Split my
live?
time between split our time between here and Washington State, up by the Olympic Mountains, and so
Okay.
we just drove down here to get out of the rain and the cold weather.
I gotcha. I gotcha. Arizona's always a guarantee that you're going to get the warmth, right?
Exactly, sun and warmth.
Did you get swept up into the whole Arizona World Series?
Just a little bit. I have to confess, I'm a Mariners fan at heart, so it was a little hard to watch it, especially with the Rangers and the Astros fighting
Yeah,
for
yeah.
where my beloved Mariners once again didn't get to.
Man, I feel bad for them. But anytime a team can win it for the first time, it's a good thing,
Yeah, yeah,
So they'll have their
exactly.
day in the sun for sure, you know. Um, but hey, it's great to meet you. And I want to begin our conversation with what we've lived through for the last 3.5 years or so, getting through COVID. How did you do?
Survived. Didn't lose any of my loved ones. Really struggled with it as a healthcare leader and professional, watching our national response to it and just the confusion around it, and it was just really disappointing on so many different levels. But I got out as good as could be, and just hoping that we turn a corner for the better in terms of how we deal with public health emergencies in our country looking forward.
We had different COVID outbreaks. I mean, we had SARS, and the response was coordinated. It wasn't this politicized thing. It was neutralized before it came over here. It just seems like this one was just from the word go turned into a fumbling massacre.
Yes, exactly. And really frustrating for I was involved in efforts for 10 years to get ready for big pandemics because we've known one would be coming at some point. And whether this was the one or not, we were for everything we had done to be ready, we weren't, and it just went off the rails from the start.
Man,
And really disappointing because we had plans in place, we had systems in place, we had a lot of the pieces in place to do a lot better, and instead we pretty much fumbled it from the first quarter through the fourth quarter, and we might not even be in the fourth quarter yet.
and that's the thing. There was actually an office set up that was there for prevention of this from happening that was dismantled. There was just seemed to be key elements that were historically a part of the institution that were dismantled prior.
Yes, and there's even a national plan that was sitting there ready to be implemented, and it really wasn't. So yeah.
So no wonder why everybody has these neuroses and conspiracy theories and all of that. There's a level of trust that has totally been eroded. When it turns into a clown show, how do you convince people that it was just a circus? I mean,
Exactly, exactly. When trust had already eroded in the decade before on so many institutional fronts, this just added to it.
yeah.
And the only bright spot for me was it really got me thinking. I wrote my first novel during COVID, and it was sort of a childhood dream of mine to write it. But the second one was actually inspired by living through COVID and watching it. And the title of it is The COVID Murders. And the reference is actually more to how we murdered the process than really the disease itself.
I had an idea during it that I would still be more than willing to talk to Spielberg about. So, there's that notion that whenever you have kids, if you play classical music or talk to the womb, it increases their intellect. So during the COVID time, all of the parents were home. They heard all the voices. There was just kind of this increased clatter. So maybe the kids that were born as a result of COVID will be the ones that will get an acumen that will come up with an antidote to prevent any more viral outbreaks from
I
happening.
like that. I like that. That's a good one.
This
We
this
have to
super
hold on to
baby.
optimism wherever we can get it.
That's it. That's it. Whether it's fictitious or not. Um,
Exactly.
so let's get to the heart and soul of what you do for a living. I'm going to put you in front of a bunch of third graders. It's career day. And one eager little kid up front says, "Hey, what do you do for a living?" How do you answer them?
Well, I would say what I used to do was I tried to run healthcare systems to try to help make sure people got healthy and stayed healthy. And now I've stepped away from that in semi-retirement, and instead I'm writing novels that are stories about that, but are really trying to point people to what it is we have to do to improve our healthcare system looking to the future.
So, what did you want to be when you were a kid? What was your dream?
It was probably to be a novelist.
There you go. You're living your dream.
Yes.
So, when, obviously, as a physician, you know, you don't have much time, you're burning the candle at both ends. You're clearly not like, "Well, I'm gonna be a novelist, while I do this." When did that idea come into you that you were like, "This is gonna happen?"
Well, I'm not a physician, first of all, but
Well,
the
yeah, I guess, yeah, I'm sorry, I worded that wrong, but
just to be, I don't
yeah,
want to assert something I'm not, but really,
exactly.
I think the time it was, I remembered my childhood dream when I stepped away from being the CEO of the Arizona Hospital and Healthcare Association. I was sort of sitting back going like, I didn't really mean to retire, but maybe I am. And what do I do now? And I said, oh yeah, I always had this dream of writing the great American novel. And I said,
Yeah.
why not?
Yeah, absolutely. So let's go back to where you were born and raised, and how did these seeds get into you to get into physician management, to do what you've done, and to even become a writer?
Sure. I was born in Hartford, Connecticut, back on the East Coast, and my dad was a dietitian at a inner city hospital in Hartford. And so, by the time I was, no more than 2 feet tall, I was volunteering in the hospital. I remember originally I would serve desserts to the staff at Christmas and Thanksgiving events. These little kind of ice cream turkeys, I remember. And so I was always around healthcare people from really a young age. And I ended up getting a job at the hospital in the storeroom. And then I ended up, when I graduated from college, getting a job of all things as a nursing administrator, although I don't have any clinical background.
Yeah,
And I just sort of fell into healthcare. It was just the thing that I loved, and I met so many wonderful, talented, smart people, and I just started to explore it as well. I just sort of fell into it and said, "Well, what am I doing here, and what do I think about it?" And I said, what I'm learning is that for this system that has all these bright, talented people and all this money being thrown at it, it really is kind of scary and doesn't seem to work that well." And so I decided to start pursuing some more educational things around that. Went to law school, not to be a lawyer, but to learn more about health policy and law in DC. And I went from, in this whole process, I went from, at one point, I thought when I started my career that I was always afraid of the idea of being a patient. And I went from being afraid, and I had this beeper on where I would get the call when things would go wrong, to being absolutely terrified by the notion. And again, surrounded by these brilliant, talented, committed people.
yeah,
And more I started to realize it was the system that was amok and really needed to be fixing. And my career after law school really became moving into different roles in the policy world and the administrative world, trying to somehow reconcile this and fix the system.
yeah,
Where I really ended up starting to steer toward was policy roles, where I would try to get in and through public policy and legal changes and legislative changes, try to create American healthcare reform in a big way that would really resolve some of the underlying problems. And that became, just again, sort of falling into it, a 30-year career of trying to do that, sometimes successfully, but overall, I had to admit at the end of my official career that the work was still left to be done.
So what was the most enjoyable part every day for you to do that job?
It was always the people.
Yeah.
I said there's just so many interesting people on all fronts, and not just the clinicians and the administrators, but the patients themselves who you'd run into, and just how grateful they were when you could come up with a solution that worked for them.
So let me ask you this. Of all of the you have to have a level of fortitude in your life. Who's been a hero for you, an inspiration?
I was really fortunate to meet a lot of the great healthcare leaders of our time, names that most people would never recognize. A Bob Sigmund, a Barney Tresnowski, and Alex McMahon. I said most people have never heard those names, but there are people who, just at their soul, were good people that were so committed to trying to doing the right thing for American healthcare. And it's just a laundry list of these great people out there that were trying to do that. And occasionally, I've found some people I really respected in the political world, not as much as I would have liked, but they're still out there. People are
Yeah.
really trying to do good.
So if you could meet one person alive on the planet right now and spend some time with them, who would it be?
Uh, I would have to say it'd be Barack Obama,
Yeah.
just to try to understand more of what he really was trying to do with the Affordable Care Act and what he thinks about it now, looking back at it.
Yeah, I might join you on that venture for sure. Um, what of all of the years that you were involved in hospitals and management, what was the most surprising thing that maybe the consumer doesn't realize that's a part of the whole process?
The most surprising thing was how little the patient is truly the center of healthcare
Yeah.
and how much it needs to be. That's a lot of the solutions I worked for over the decades was exactly that. But I think most people would be surprised of just how almost irrelevant the patient is in terms of how the systems are set up. To me, that's always been the core defect that that's not what we're oriented around is taking care of the patient, even though that's exactly what's happening. And somehow that we have to really commit to improving that in reality, not just talk.
The one thing that I've always loved about the Canadian, I interview a lot of Canadians, and I love the way that they do things. Like the artists up there get grants, jazz musicians and other musicians. The government really puts their money where their mouth is, and the arts is
Right.
very important for our mental stability and also the socialized healthcare. And whenever I bring it up, they're slow or they're quick, I should say there's waiting lists and it's not this utopia. But it still seems to me that a system that will allow people not to go bankrupt or live in fear because they can't afford it seems to create a better mental stasis. What's your take on how we approach financing it for the health of all of us?
Yes, I think you do find that equity there, but not just even in Canadian systems or British systems, which are socialized,
Yeah.
but you go to more hybrid systems in Germany and Australia and other countries around the globe, you will find a greater sense of equity and acceptance of the limitations of this system just because everybody has a place in it, much more so than in the United States. Again, one of our core defects. So, and I think that core sense of equity and feeling you have a place is just critical to the amount that you will trust and believe in the system. And it's always been one of our failings to have so many people fall out of this system, and people know they fall out of this system, and it be so harsh and be unfortunately too often when you need it the most, when you find out that you've got some horrible disease that is absolutely no fault of yours, just the bad luck of the draw.
Yeah.
And that's when it fails you and just loses. You lose a lot of credibility and trust when you have that. Again, we'll never have a socialized system like Canada, in my opinion, but there are these threads of it that you can't ignore that are the benefits of it. And how do you get the benefits out of what will have to be a uniquely American solution?
So, as you said, you did a lot of work to untangle the mess that exists within that system. But as you said, there's a lot of work to do. Do you have faith that as the generations succeed down the line that we're going to get there?
I'm an optimist by nature, although I'm being challenged. I would say the COVID experience and watching not necessarily what happened about COVID, but how the healthcare system evolved during that time made me more skeptical of our ability to get there. But again, I'm trying to hold my optimism and belief that we will get there and we'll find the way through. But we really have to commit to doing some of these things in the public policy world, but also just in our own personal lives to take greater control of our healthcare, for example, and assert our power to be the ones to shape the future of the healthcare system rather than letting politicians or healthcare administrators or others say this is what you have to have.
Yeah, that's interesting. Everybody that I've really heard that's been in the trenches during COVID, their level of skepticism and just the gloom that they saw was just too much, you know.
It was
Um,
really, really sad.
yeah,
And psychically, I mean, the some of the clinicians who would go through these horrible days at work and shift after shift and watching people die and die alone because their loved ones couldn't be with them. And the reward at times was just going out in the community wearing their scrubs and being attacked as crazy people, right?
yeah,
Somehow
yeah.
trying to save people's lives and being heartbroken over it. I've talked to a lot of people who just said they can't go back to doing what they did before because of that.
It's weird because it's kinda like with Vietnam when soldiers came back, like, why are these
Yes.
guys getting pelted for doing what they were called to do? And a lot of them didn't even have a choice, you know?
Right,
So
yeah,
why
great
do
great
they?
analogy.
It's wild, man. So of all of the things that you've done, you've obviously seen a lot of things, but of all the successes and good stories, what's one of your favorites? Favorite professional success story?
Um, I'd have to say it was, the Washington Health Foundation, which I helped create way back when, back in 1992, and it's not just creating an organization, but that it was committed to somehow figuring out how you could actually get people to sort of take a greater role in finding solutions where they would agree upon. So, it's sort of a ethereal comment. But what we did was we tried to engage people in actual conversations around the entire state of Washington about the healthcare system. And instead of sort of looking for the fight and the disagreement, we looked for the agreement. And we were just amazed by doing. We did 42 community roundtables across the state, and they were structured so nobody could dominate them. And we found just violent agreement on a values basis about what people believed in, things like equity and fairness, and wanting to find common answers as Americans. And I'm so proud of watching that come together and trying to use that as a basis to find, legislative solutions, other practical things. And that was the good side. The harder part was watching it then devolve into special interests and others trying to suck the life out of all the agreement that we found into things that were more like that, just
Yeah,
conflicting and made it difficult. But the goodwill and the sense of American common sense and good being, it was just phenomenal to watch that.
yeah. So let's say you have a dream tonight. You run into a 20-year-old version of yourself. You could give that younger version of you a piece of advice based on the wisdom you've gained in your life up to this point. What advice would you dispense on that younger version of you?
Say, find your passion and don't let the naysayers drag you away from it. I felt pretty good over my career that I was sticking to it, but there were a few times when I hesitated, where I was being told I was crazy. You can't think that way. You can't do that. And I look back at it now and say, I wish I was a little bit tougher about that then. And I'm
Yeah.
trying to make up for lost time with what I'm doing now.
So as a writer and an author, what was the book when you were a kid that you read that really opened the gates, really made you want to read more, or maybe write one day?
Well, it was a little later in life. It was Tom Robbins, Even Cowgirls Get the
Yeah.
Blues, because it was such a departure on normal literature and what you could think and write about.
Yeah.
And his writing style was fantastic too. But there are other books when I was growing up, but that was the book that really got me thinking about novels in an entirely different way.
Yeah, 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 he is. He's good. So let me ask you this. If you could go back in time and witness one event in human history with your own eyes, what would you love to have seen happen?
I think it would have been the Emancipation Proclamation
Yeah,
and Abraham Lincoln taking that to reality.
yeah,
It just seems like such a remarkable thing and such a remarkable time.
yeah. Abraham Lincoln's always on the top of that list, whether it's, a speech, Gettysburg, or whatever. So
Mhm.
it's amazing how much allure he still holds in the American psyche.
Yeah, yeah. The
Yeah.
Gettysburg Address will be right behind it. I
Yeah, right.
I tell people the only time I seem to cry is whenever I hear the Gettysburg Address.
Yeah. Yeah, it's moving, it's powerful. So, of all of the things that you've done in your life, all the things you've accomplished and overcome and become, what are you the proudest of?
um, Proud to trying to do the right thing and trying not to get lost in the ego and the money and the trappings of success, and just trying to stick to my guns and say that no, I'm not really after a career where I'm the wealthiest person in the world or everybody says how wonderful you are, but just trying to figure out and keep trying to do the right thing because there's lots of temptations out there.
Yeah. It's interesting. I come from Generation X, and we were kind of the generation that kind of tried to get rid of the 50s norms and tried to travel and to do things and live a carpe diem moment. Seems like the millennials are kind of taking the reign and doing things in a way. I know this is a broad generalization, but from what I've experienced, I think they're really chartering a future. They're much more open-minded, and we have all of these new elements of transgender and acceptance and all of these things. I'm hoping that what you've said you're the proudest of is really being imbued in this younger generation.
Yeah, I hope so too. And I think it's just a fascinating generation to watch because of the way information now flows in such a different way. And there's incredible potential for it to be harnessed for good,
Yeah,
incredible potential for it harnessed to be bad for too.
true.
But that's what I see out there, and that's what I have to hope. And when we had a lot of students involved in our work at the different organizations I ran, and I was always really encouraged by talking with them and working with them and seeing how their minds click differently, and that so many of them were seeming to want to find the right path forward.
And a lot of them are entrepreneurs. They're not
Yes,
all, and I think healthcare is a part of that. There's a fear, especially with the Gen Xers, where it's like, you got to have health insurance.
right.
That that's why you don't charter your own boat, because if you have to pay for it out of pocket, So there's a lot of those levels, but I just think this younger generation's like, I'm going to do my own thing, which is good for them.
Yep, I agree.
Yeah, definitely. So everyone out there has a perception of you, family, friends, clients, colleagues, readers of your books, but you ultimately run the show. What's your perception of you? Who do you think you are?
I think I'm just a regular guy trying to do the right thing. Has been blessed by a lot of great and luck and opportunity, and that I've just been able to sort of take advantage of what was presented to me, and I've just tried to be a good person. Some of the things I'm proudest in my career is I ran organizations for 20 years, and we were never sued. So
Oh,
I say
wow.
I take that as a good thing that,
Yeah, I would
we're
say
not
so.
building ill will, we're building the right way to relate to people just in our everyday affairs. And hopefully some of that spilled over into what we were doing that was the object of our work too.
That's monolithic from for healthcare because there's at least some level of litigation that's always
Yes.
going on. What's the best advice you've ever gotten?
To keep the patient in mind.
Yeah.
When you're sitting in a meeting in a hospital or a hospital association or a legislature and people are spinning around their wheels about something, just to go, well, what's in it for the patient?
Hippocratic oath, right?
Yes. Yeah.
Um, so what's been the best feedback, best fan letter you've gotten from your writing so far?
I think the one I liked the most was somebody who read my most recent book, and they actually gave me a 4 instead of 5 stars, and they said this book wasn't what I expected to be, and they really liked about it was my character development, because that made me feel like I was actually becoming really an author,
Yeah,
because that was my characters that he was living the story through. I said
yeah.
this guy got what I was trying to do.
That's cool. Very cool. So if anyone wants to get your books, they want to learn more about you, reach out. How do they do that?
Books are on Amazon. The first one is The Theory of Irv, more of a historical fiction book, but they're all medical detective stories. They're just entertaining, page-turning stories with the health policy stuff infused in a really practical and understandable way. The COVID Murders is the most recent one, so they're both on Amazon. You could also go to the Washington Health Foundation website, washhealthfoundation.org, and there's a book place there, and I've got a video up there which is why I wrote the books and ways to access it and get our monthly policy blogs, things like that. I
Right on.
encourage people just to check it out and let me know what you think of them. It said they're
Yeah,
not for everyone, but they're actually going pretty well, and I think people like my kind of odd take on the American healthcare system.
we need it. We need it for sure. Greg, thank you so much for your story. Thank you for your time. Best of luck with everything.
Thank you. Enjoy talking with you.
It was great.